This is Conversations in the Clinic. I'm Dr. Kelly, and today we are talking again about pickleball injuries, this time about pain in your heel. As I play pickleball and I serve and stay, or I return and I run up to the kitchen, a genuine fear that I have is doing something to my Achilles tendon. Of all of the injuries that I see here in the office, tearing my Achilles, knock on wood, is the one I fear the most because it's a nasty injury. It takes a really long time to heal, and you need surgery to heal it. I don't think I've ever seen or heard of an Achilles injury that healed without surgery. So, heel pain can be a possible predictor and certainly an indicator of an issue with the Achilles tendon. The Achilles tendon attaches your calf muscles to the bottom of your foot. And it can be tight in cases of plantar fasciitis. It can be tight in cases of like calf strains. There's a couple different things that can cause pain in a heel. And as soon as I saw this question pop up on a Facebook group that I'm a part of, I said, I have to talk about this because it's honestly, my biggest fear as a pickleball player and as a physical therapist. So if you start to have pain in your heel, there's a couple things to look at. Number one is, I say this almost on every episode, the volume of pickleball that you're playing or the volume of whatever it is that you're doing. You could be running, tennis, basketball, whatever it is. Look at, did you slowly increase over the course of a month the amount of time that you were playing this game? Or did you learn it on Monday and play it for 20 hours before Friday? Okay, so that's the first place to look, is this overuse, underprepared injury. The second place to look is the foundational strength of your foot. If you are in high heels all the time, or you are in work shoes all the time, or you are in boots all the time, and then you change footwear and put a really high demand on the muscles of your foot and your ankle that they're not used to, this kind of falls in the overuse bucket. It's really normal and common for it to be painful after that. So look at the foundational strength. Can you balance on one foot for more than 10 seconds? Can you jump rope, or if not actually jump rope, like do the motion as if you were going to be jumping rope? Those are really important foundational exercises and movements to be able to do in order to prevent and reduce your risk of heel pain. And another really important contributing factor can be tightness of your calf muscle. Raise your hand if you stretch before and after you play. Never a hand goes up. It's really important to maintain mobility and flexibility of your foot and your ankle, not just for pickleball, but even as you get older. Think of your typical old person. They shuffle, right? And part of the reason they shuffle is because they don't have the flexibility and the mobility of their foot and their ankle because they stopped using it. If you don't use it, you lose it. So tightness in your muscles, overuse injuries, and foundational strength can be really significant contributing factors to heel pain. And there's really simple ways to reduce your risk of that, to improve your heel pain and eventually make it go away. But make sure you are addressing the root cause of the issue and not just taking an Advil or an Aleve or a Motrin before you go out and play. I appreciate you. Thank you for spending some time and your attention with me today. Keep moving and keep getting better every day.